Hi everyone, I'm super excited to share my list of treatments and trends in plastic surgery that I'm officially over. I've had a lot of experience with this. I'm not just throwing these things up here because I don't do them. Most of them I've actually done and I've learned the hard way, and many of them I was smart enough to avoid doing. Make sure you watch this all the way to the end. Empower yourself, make good decisions. And in case you don't know, I'm Dr. Karam. I'm a board-certified facial plastic surgeon. I'm also the founder and creator of KaramMD Skin. Today we're gonna delve in and talk about some procedures that I've selected that, in my opinion, don't meet the expectations, under-delivering, over-expectant, ultimately not worth doing at all. So I'm gonna go through that list with you. I'm gonna share some stories and anecdotes about my own personal experiences with them, how I arrived at this decision, but ultimately why this is important for you is really because you're trying to make decisions about what's worth doing and what's not worth doing, and there's a lot of decisions and choices out there. And frankly, that's the number one reason why this entire channel exists, is to help people make good decisions for themselves, empower themselves. So if you haven't already, make sure you subscribe to this channel. What I'm gonna talk about today are things that I don't like. There's a video coming up that's gonna be talking about things that I do like. So subscribe so you can follow along and make sure you don't miss the second segment of this concept. All right, without further ado, let's break it down. So let's talk first about how I make decisions. So number one, I am a facial plastic surgeon. I'm very careful about things that I bring into my office. It's been this way for the last 20-something years that I've been in practice. So the way I decide whether a treatment belongs in my practice, which means something I'm gonna recommend ultimately, is not ever because of marketing hype and a swell of interest that comes from the community, etc. It's always based on whether or not that treatment actually works and meets the expectation, but most importantly, would it be something that I would comfortably do for myself or my wife? That's a high standard. So if it's not good enough for her or for me, then it's not good enough for my patients. That's how I hold every decision to. Because I feel I'm a steward of their trust in me, and I have to deliver on that, and therefore I'm gonna be careful about what I recommend. I look at each decision from a risk-benefit point of view. To me, a good procedure has a high reward, low risk, not the opposite, high risk, low reward. And we'll go through each of these procedures with that in mind. The other aspect that is equally as important to all of those is give the procedure some time in the world. Don't be the guinea pig in any procedure. And anytime something has come into the marketplace, I let it live for about 2 years out there and hear what people have to say about it, see what the results are, and then I pick up the phone and I start making calls to colleagues around the country who have that particular device, who have that particular procedure, and I ask them frankly, hey, is this thing delivering? Is it worth doing? And if the answer is no, then I know it's not worth bringing in. If they give me a strong, glowing recommendation for it, yeah, this is groundbreaking, this is awesome, then I bring it in. So those are the ways that I decide on treatments, and ultimately, everything that's on this list has either gone through my own personal experiences or the experiences of trusted colleagues and the test of time. All right, so let's break it down. The first item on this list is threads. I've been in practice, like I said, for 20 years, and before that I've been, a hardcore student of it for about 10 or 11 years. So 30-something years of watching this industry evolve. Right during my fellowship, actually, the trend of threads blew up. There was a company that came out called Contour Thread Lifts. It took everything by storm. It was like the hottest concept. They're putting in basically non-dissolvable barbed sutures to hold the face up. And the concept was they're barbed. When you slide the tissue above it, this tissue can't slide down, so it's gonna give you traction and hold the face into place. So it was basically supposed to be a non-invasive, non-surgical replacement of facelifts. And I'm literally in my fellowship for facial plastic surgery when this came out, which excited all of the surgeons around the country, including non-surgeons. But the bottom line is it was gonna be, okay, we can open the door for a lot more people and get a lot more treatments for them, the people who are not ready for surgery or maybe who are not interested in surgery, an alternative. We started doing this in my fellowship. And I remember one case in particular, this patient wasn't a candidate for surgery because she was a smoker. She had a lot of excess skin. She was in her 50s. And so they thought a perfect candidate, not a good surgical candidate, and aging. So we did this procedure on her. It was shocking, like in the moment we're doing it, we lay the threads in, it goes from the top down here and you put a multiple in, then you hike the tissue over the threads and then you walk, let go and then the face is up. So it's like, wow, okay, the cheeks went up. But then around this area, there's all this bunching of skin. All this stuff was bunching up in that area. So it's like, well, what do you do with that skin? Well, I guess the concept is that with time, it just sort of opens up again and it relaxes, but it looks really weird and stupid while it's in that position. Not to mention, the patient was in pretty excruciating pain as these barbed sutures were sitting underneath the skin, holding everything up. I think we did 1 or 2 more of those treatments, and it became very, very clear that this was a pretty dumb idea. Frankly, it didn't take that long. I think within a year or 2 after that point, the company completely went bankrupt and it disappeared. Everyone realized that this was a complete waste of time, money, and risk, not to mention all the deformity and infections and all the other things that came with it. It just didn't take off. Fast forward almost 20 years, thread lifts came up again. Now they're dissolvable sutures. This is what you guys are all probably aware of, these PDO threads, these dissolving sutures that are made of basically like a suture material that goes away. The concept, I was looking at it, I was like, wow, why is this coming back up? You know, we really tested it in the most hardcore way and it turned out to be a bad idea. Why is it coming back up? Well, things in our field do that all the time. You know, things go away. Marketers think, okay, well, people have forgotten about it. Let's rename it, bring it back again as a new concept, and let's get another ride of sales from it. Terrible, terrible thing. Trust me, I hate that aspect of this profession. I did a whole video on this topic before, but basically it's what's happened. Of course, this time around, you know, I didn't get involved in it. There's been a number of studies that show the risk of infection, contour irregularities, nerve damage, blah, blah, blah. But every procedure has those risks, right? I mean, anything you do has a risk of infection and all that kind of stuff. The question is, what's the benefit? Remember, we're looking at this from a risk-benefit point of view. The results generally last about 3 to 6 months. Now, every time I say that, I get a ton of people who agree with me because their own personal experience. And then once in a while, we get someone who says, no, it did really well for me. Well, that's great if it does really well for you. But in general, the actual reality is, especially for people who are looking at this as an alternative, who are a little bit older, in their 50s, etc., it's not going to replace surgery. You're not even going to get a sufficient level of correction from it to it. Now, if you're like in your 30s and you're kind of playing around with it, maybe those are the people who are responding this way, 40s, whatever, but it'll never give you the magnitude of change, but it also won't give you the durability. So you say, all right, fine, well, it costs so much less, you know, I'll do it over and over again. Go ahead. I mean, if that's how you want to approach your aging process, then go ahead and do it that way. But most people want to kind of get control of it and stay ahead of it. And the reality is everything costs money. Everything does. I mean, threads cost money. And if you have to do it every 6 months to a year or whatever it is, I mean, you can just extrapolate that fee out and eventually it'll be what a facelift would cost. But more importantly, I don't even think people are getting that much durability out of these procedures. Not from what I've seen, not from the reactions for these videos, etc. So to me, that's a trend that needs to go away. It just doesn't have a place in it. And those are the reasons why. High risk, low reward really doesn't make a lot of sense. Facial fascia is sagging. You need to get it back up into position and you need to get it back up with a high quality surgical procedure like a deep plane facelift, vertical restore, something that's going to really keep it there and give you some mental liberation, not to have to be thinking about your aging process, you know, month after month, year after year. Really, at the end of the day, that's kind of the part of the big goal, right? To look as young as you feel. All right, so let's go on to the next one. Next category is this idea of using fillers, again, as an alternative to a facelift. For almost 20 years as a practicing facial plastic surgeon, I've been seeing new ideas come up every other day about where to put filler to basically contour the face in a way that it doesn't look as aged. My own personal experience, and I've done tons of filler. I even used to be basically a trainer for Allergan, you know, the makers of Juvederm and Botox. I don't want to say I drank the Kool-Aid, but how would I know the difference, right? I mean, I was a big volume loss person. I realized that volume loss was an important part of facial aging, and you can use fat transfer, which I have always loved, but some people want to do something a little quicker, a little bit less invasively, so I would do fillers for them. It did not take me long. Embarrassingly, it took longer than it should have. It took me 10 years, 12 years, 15 years, whatever it was, for me to realize that the fillers that we're using on these faces, on the cheeks and, you know, along the jawline, etc., were not really making people look younger. They were, you know, maybe camouflaging some of the laxity along the jawline, maybe they were making the cheeks look a little bit better, but really, at the end of the day, there's a couple important points here. Sagging continued, necks continued to sag, etc. Jawlines became bigger and bigger, cheeks became wider and wider. The face started looking different. And once I realized that pretty much if you're in the facial sagging phase of your life, which is like 50 and above, fillers in that way is not a treatment you want to do. Why? Because A, it doesn't stop you from aging. B, it starts to make you look weird. And we definitely have seen lots of celebrities, and we've even talked about it on this channel, Courtney Cox, Kristen Davis, who say they're dissolving it, you know, is the worst decision they made, et cetera, et cetera. And, you know, we've learned from them, we learned from our own experiences, we learned from our friends who go through this, but fundamentally, the use of filler in that way is a dumb idea. Almost every patient I operate on has had a 5 to 10 year run with fillers before they come in for their surgery. And their biggest regret, frankly, is when they pull up a picture of themselves when they're in their 30s, their face is just a lot fuller looking than it ever has looked. Unless you're in a situation where you're gonna go and like try to dissolve all of it, which takes multiple treatments under ultrasound guidance and this and that, and which frankly, I personally don't have the patience to do. That's just not my thing. I mean, there are some doctors that are doing that type of stuff, but that's a lot of needle pricks and a lot of this and that. I don't even think you can really get it all out of there, because there's a transition from fibrosis that occurs that really becomes more scar tissue. And we talked about this on this channel also, that fillers in the mid-face and the cheeks, especially if later you're gonna do a deep plane facelift, can cause some fibrosis and scarring in that delicate plane, which will make surgery more difficult. Now, again, I'm used to working in that space. I do 6 of these vertical restores a week. I've 20 years of experience. I'm used to it, and I can get through it, and I can do a great job with it. I always worry about the surgeon who's newer to it or who's not doing the volume that I'm doing and doesn't have the experience, how they're gonna find it to be sticky and stuck in there, and they're gonna potentially either back out or not do a great job, or even worse, nick a nerve or do something like that. So for me, fillers in the mid-face and the cheeks is a big no-no. Now, in the upcoming video is gonna talk about where you can put filler that is actually a useful and good part of the facial rejuvenating process. So I'm not totally anti-filler, it's just you gotta use it the right way. But as a general point, cheeks and jawline, big no-no, in my opinion. The next category is this idea of surgery that addresses partial parts of the face at the same time. For example, mini facelifts, lower facelifts, neck lifts, totally dumb idea. First of all, your face doesn't age in segments, it ages together. This entire fascia from the top of your temple all the way down to your neck is literally one thing. It's one fascia. And with age, that fascia becomes longer and longer. So you see the crowding around the corners of the eyes, the mid-face comes down, deepening in the nasolabial folds, a little crease in the middle of the cheek area. Jawline starts to sag. You start to see jowling as the cheek hangs over the jawline. And of course, finally, the neck starts to sag. So all of that is a connected fascia sheet that gets longer with age. It literally elongates. So when somebody comes in and, for example, asks for a neck lift, tightening this area and leaving jowls looks stupid. Frankly, it's a dumb idea. It doesn't look natural, it doesn't look normal. Plus, the reason your neck is sagging is because your face is coming down. You don't believe me? Just do this. If you have neck laxity, grab a hold of your face right here, literally right here, and pull up. Look what it does to your neck. Your entire neck moves up. It's because the neck muscle, the platysmal muscle, is intertwined and attached to the facial fascia, which is called the SMAS. That area comes up. Now look what happens if you keep going up. Well, look, you get bunching here. Well, that's because this temporal area is connected to the lower part. So all of this is generally connected to each other. So when you go and do a partial facelift, like a lower facelift, so you tighten your lower face, well, what happens to your mid face? This part comes down, this part looks weird, neck doesn't get addressed. All these aspects look imbalanced and they look non-harmonious, and more importantly, they look unnatural. I actually went the opposite direction after 10 years. I went more aggressive. The vertical restore, which is based off of a deep plane, which is the most aggressive style of lift you could possibly do, is completely the opposite extreme of a mini facelift. It's the most, call it invasive or whatever you want to call it. And the reason I did that was because even though I had really natural looking results in the past, because I always would go up in a vertical direction, the results weren't lasting as long as I would hope. And what would end up happening is patients would come back after 5 or 6 years, and that's actually pretty good, and they start to look a little worn, a little tired looking. So maybe 8, 9, 10 years you do another lift. Well, deep planes in the vertical restore, which uses a deep plane in this upward vertical direction, incorporates the lateral brow, mid-face, jawline, and neck. That's what makes the vertical restore unique. Deep plane allows it to be durable because it releases all of the ligaments that are basically pulling against it. So you get this complete comprehensive look with the vertical restore that addresses all aspects, so the whole result looks normal and natural, and you get durability. So the idea with these partial lifts is lack of durability. You don't want to go through surgery too many times. I mean, in addition to, again, the risks, rewards, not worth it, but it makes surgery harder for the next surgeon who wants to do it. Plus you have to go through a whole nother downtime and a whole nother expense. Do it right the first time. Next category is this whole umbrella of energy devices. Everyone's trying to avoid having surgery. scarring, expense, downtime, et cetera, et cetera. Every other year, you have a new device that comes out that promises to be the answer. And in this category, there's too many names to mention, but the big ones are Morpheus 8, All Therapy. They all work slightly differently, but they're all trying to deliver energy into the deeper tissue, which is that SMAS, that fascia that I talked to you about, to contract the SMAS, because when you put heat on tissue, it shrinks. You can do that to a piece of chicken that you're cooking. So the idea is that you deliver heat into that elongated fascia and it's gonna shorten it. I mean, it makes perfect sense from logic's point of view, but the only thing that was never really fundamentally understood is as you're going from the outside to the inside, the fascia is actually below the subcutaneous fat, which is the fat under your skin. It's a very thin layer, and below that is nerves. You can't be that precise with this. And you're gonna err on the side of not hitting a nerve, because if you hit a nerve in the face, well, the person has facial paralysis and they're gonna be really upset if they can't smile or raise their forehead or whatever it is. So you're gonna go a little bit more shallow, but deep enough to get through the skin, because the skin is 1 millimeter or 2. So you're gonna shoot for like 3, 4, sort of 5 millimeters in that range. Well, guess what's in that range? It's your subcutaneous fat. And we've done videos on this. And if you look at the comments and you hear about it, I mean, I used to think this was complete BS when people would contact our office, say, hey, I did a Morpheus 8 and my face looks older than it did, this and that. I thought, but then it just got too overwhelming of people saying it. And then when you really start thinking about the physics and the science behind it, it actually makes a lot of sense. But I see patients all the time, unfortunately, where they've lost so much of their facial and neck fat. That is irreplaceable. You cannot do a fat transfer and replace the fat underneath the skin. That's what gives the face that suppleness, that fullness. When you're doing a fat transfer, you're putting in the deep tissues, you're not treating the subcutaneous fat. So once that fat is dissolved, it's done. So in addition to the risks, what I just mentioned, there's literally effectively no upside to it. You're not gonna get your face to respond. You're not gonna get your jowls to come up the way it does with a facelift. It's just not. Who in the world would be happy with like a 10% improvement over a heavy jawline and neck? I mean, no one I've ever met wants a little correction if they have heavy jowls and necks. They want to get in front of it and they want to correct it, wipe their hands free from it, continue doing skincare, do Botox, and call it a day. Live like a 30-something-year-old. This whole category, very low reward, very high risk. The balance is completely off. To me, never have I ever even thought about bringing those treatments in, because every single time I even considered it, I got on the phone, talked to my colleagues around the country, and every one of them said that even though they have it and they're using it, every one of them said it doesn't work, it doesn't do anything. And now you're starting to see people catching on. I've been talking about this literally for years. I think there's a bit more consensus and community coming together expressing the view on this. So I'm not a fan, never will be. We've tried all different types of technology. None of them have been able to adequately resolve laxity and shape change of the face. This last one, I think it's on its way out. It was super popular in the 70s and then had a resurgence. It's buccal fat removal. In 2023, this was a big trend. A lot of models and actresses and stuff were doing buccal fat removal. I've always been an anti-buccal fat removal person, especially for young people. There are select cases, obviously, where you should do it. I mean, people with like really heavy faces, but people have been doing it to look a little bit more sculpted, et cetera. The same reason that the models and actresses and the public was doing it back in the 70s. But what they found was you can easily overdo it and you can end up looking really gaunt and hollowed out in this area. But also with age, you're gonna lose volume in this region anyway. So taking this area out, making everything really hollowed out, is not a good look. It's not a healthy, vibrant, youthful look. So I'm happy to see this trend is almost gone, but I was surprised to see it come back. And what always amazes me, and I hope you're not one of these people, but I'm sure there's a lot of people listening to this who've fallen for this stuff. But I can't imagine how easy it is for people to allow themselves to undergo certain types of plastic surgery procedures that basically have permanent results, like that fox eye trend. These are like real operations that have permanent effects. I'm always amazed at how easy people are with their faces and doing things. To me, it's the most precious thing, and it really deserves a lot of care and consideration before doing certain things, and trust that you're making the right decision. Again, this is what this entire channel is about, give you a perspective. Hopefully you feel like you can trust. But yeah, this trend is on its way out, and I'm happy to see it gone. One of the final points here is be careful, be mindful. Everyone these days has a platform to talk to you. If friends send you a TikTok video, an IG reel, YouTube video, whatever, don't fall for that. I'm trying to set the stage for you to evaluate these decisions yourself, and you can use this to your advantage to make smart decisions. But don't fall for trends. Every day somebody has a different thing they want to sell you. Understand the reasons behind it, understand how it all plays out. So now let's talk about where the state of the art is. So every industry has a stage where things really evolve and then they kind of plateau, and that's okay. If it's not broken, why fix it? The field of plastic surgery definitely had problems. One, results were looking unnatural. There's obviously a huge variation of surgeries, et cetera, et cetera. I look at my own outcomes. I mean, because I've been evolving, right? As a surgeon, I've been practicing for 20 years, tweaking and getting better. The vertical restore, the fat transfer, upper lid, lower eyelid combination with a lip lift in some cases, you can't get better than that. How can you look better than the before and afters that I share with you guys? I mean, they look 100% natural. The results last a very long time. It's a 2-3 week recovery and then you're done. I really am struggling finding a way to make it better. So to me, now it's about kind of we're at a steady state with the results. So my opinion is this is what the state of the art is. Everyone at any age, you treat your skin with sun protection and the actives that I talk about that are in the trifecta. The results we see with the trifecta, frankly, cannot get better. People's skin are always improving. How do you get better with supple, glowing, bright, flawless looking skin? So you can't. You speed it along with certain lasers, which I'm gonna talk about in the next video. So make sure, again, you subscribe and watch. Skin is taken care of at home by you. So there's your skin. The other half is shape. At the end of the day, it's gonna be a solid facelift. Deep plane, vertical restore, comprehensive, treat the neck, treat the lateral brow, treat the eyes, get some volume back in, fat transfer. That's how you're gonna rejuvenate the face. Do a little Botox, take care of the skin after surgery. I don't see really any room for anything else. That's the state of the art. This entire spectrum of trends need to go away. There you have it. All right, folks. I hope you enjoyed this video. I hope you learned something. Make sure you subscribe to this channel. Make sure you watch the next video that'll complement this particular video. And if you want more information on this subject, sign up for the KaramMD Journal, as well as check out our 2 websites. I think you'll find a lot of good information there and examples of all this. All right, folks. Until next time, Dr. Amir Karam.